Good afternoon, I'm Christy Myers, and welcome to the Menninger Clinic Facebook Live for this January 2019. Our topic this afternoon is an important one. It's autism and how the autism spectrum disorder affects families and what's new for those families who are dealing with children who have an autism spectrum disorder problem. So today we want to welcome Dr. Jonathan Stevens, the Menninger Clinic Chief of Child and Adolescent Psychiatry and Assistant Professor of Psychiatry at Baylor College of Medicine. Welcome.
Thank you.
And Dr. Alton Bozeman, Menninger staff psychologist who does cognitive testing and autism assessments. Thank you for being here with us.
Thank you.
First of all, many of you know about autism, but we'd like to get a definition again. For those who may not, what exactly is autism and the spectrum disorder? How does that work?
Well, autism was initially characterized decades ago, and was thought to be, even until the 80s, to be a rare, severe, almost catastrophic illness that was rarely seen even by a child psychiatrist or child psychologist like Dr. Bozeman and myself. As criteria have been more formally diagnosed with DSM, which is our diagnostic manual in 1994, and then revamped in 2013, diagnosis has increased, and really the public visibility of this diagnosis has increased dramatically. So I think of other conditions that have really risen to the public attention, in some ways good, in some ways not, from movies like Rain Man or even Napoleon Dynamite, to just people realizing this exists in our friends, in our family, in our neighborhoods, that it is a more common condition than ever originally thought of.
And the CDC is now saying that 1 in 59 children may be on the autism spectrum disorder. Why do you think these numbers are going up so much?
We think it's a combination. So in part, we do think that there has been an increase in the incidence and prevalence of autism. We also think, as Dr. Stevens mentioned, that it's more, people are more aware of it, and so therefore it's being identified and diagnosed more. And then those numbers kind of differ depending on which research you look at. What we're seeing is as high as 1 in 40 to 1 in 59 through that CDC study that you mentioned.
There's a big difference between boys and girls. Boys and young men are disproportionately affected. Some 4 to 5 boys are diagnosed for every girl that's diagnosed. So when we say 1 in 40, 1 in 40s, that's typically boys. For girls and women, maybe 1 in 200. But when you put that together, this is where you get the 1 in high 60s number.
What is the reasoning for more boys than girls having autism?
We don't know, but there are genetic factors that are likely at play. And the genetics of autism and the autism spectrum, there's a lot of research going into this, but there is no one gene or one set of genes that can yet explain all of the autism spectrum. There is a spectrum. There's some mild cases where people are very high functioning. Some of my patients with autism could go to college and could lead very productive lives. Some people are nonverbal and really need a lot of support from family and community just to get through a single day.
Well, we talked about prevention. If it's a genetic disorder, there's likely no way to prevent it. And we know of some families who've had more than one child with autism. What do you advise those families who didn't know there were autism spectrum disorder problems in their families?
That's a good question. I'm not sure what we could say as far as advice as prevention, as you mentioned, but maybe being aware of it, so therefore it can maybe be caught earlier. So what we do know is there's a higher incidence in siblings, and so with the most high incidence being identical twins, followed by fraternal twins, and that's because they share not only the same genetics and identical, but also the same environment. And then in fraternal twins, they're sharing the same environment. So therefore, both the environmental factors and the biological factors are very closely related. And so we know that there's a higher incidence in that. There's been a lot of research recently looking at siblings that are even separated by several years and seeing that there's some traits of autism that may not make it quite to the level of getting the diagnosis, but are still present. And so I guess my advice to families would be to be aware of it and maybe catch early signs, and so therefore that you can start early interventions.
And what kinds of early signs should parents watch for?
Well, this is, when we talk about autism, there's a range of social, communication, and behavioral deficits. In the social, it could be difficulty maintaining eye contact like you and I. We're nodding. It's called reciprocity, an emotional give and take. Children and young adults with autism sometimes struggle in that domain. that could impact, especially during the school years, ability to form relationships, make friends, maintain friendships. Communication, some, in severe cases, are completely nonverbal and have to communicate via technology now, or very low kind of functioning vocalizations, or maybe a single word or phrase which functions for a variety of needs. It could be quite tragic. Behaviorally, a lot of repetitive behaviors, a lot of need for sameness, if you can't change the room or an outfit or a type of clothing, arranging things, interests that are very, very constricted. It's only a couple of interests, unlike children who generally have a wide range of interests, and pretend play. That lack of pretend play is completely devoid.
So why is it so critical to diagnose this early and get started on the therapy? That apparently is making a big difference to diagnose early.
Well, the diagnosis early is earlier intervention, and the interventions can begin even before school begins, and so crucial. So if a child's not speaking at 2, or doesn't have sentences at 3 years of age, to get a full speech evaluation and speech therapy ongoing. There's also, is there hearing a problem if someone's not speaking? There's a medical evaluation that can be done. A medical evaluation that could look not only at blood, MRI, but even now genetics, and the age of genetics and personalized medicine. And then the interventions that a child's going to need later in life, both at home and at school. You need to get this early as possible. We've seen people here at the Menninger Clinic who haven't been diagnosed heading into middle school. And unfortunately, the ability to get treatments and get better outcomes is very limited when you're at that age, especially if language is not developed or basic socialization skills have not developed.
And what else would you advise parents who say, well, I'm going to take my child to the doctor and see if these problems that I'm seeing, and I'm not sure if they do turn out to be autism, what do they do next?
So it would depend on what some of the presenting issues are. So some individuals with autism might also have behavioral problems. And so in which case you would then want to find behavioral-based interventions, which might be on the mental health side, or it might be more of a strict behavioral, such as applied behavior analysis. Also, as Dr. Stevens mentioned, speech would be important, possibly occupational therapy, that fine motor deficits are frequently co-occurring with people with autism. And then it also would be the schools. So you'd want the schools to know, which could be a balancing act, because on one hand, you want to push your child to top potential in the school setting, but you also want the school to give fair accommodations.
Those are tricky. And now I want to remind our Facebook friends that you can send questions in. We would like to have your questions. This is an opportunity for you to address the doctors and to get some advice. And we've had a few that have already sent in questions. Jennifer has had a very interesting question she sent to us. She says, I've hit many barriers to diagnosis and lack the energy to self-advocate. Is there any help available for this? How would you help her?
Well, this is the bottleneck. A lot of parents that I see met with their pediatrician, and most pediatricians at the age of 18 months and 24 months are doing screening. If something comes up in that routine screening with your pediatrician, that gets flagged for referral generally to a multidisciplinary group. This is a group of perhaps some child psychologists, pediatricians or developmental pediatricians, could be a psychiatrist, could be a child neurologist. It's generally a team that does a diagnostic evaluation, and that's different from the screen. The screen might be a few questions that get asked of a parent during a pediatrician visit, but there's a lot going on in those visits. This is specifically looking at the developmental trajectory of that child, and it's hard to get those appointments. I've heard here in Harris County that there's still delays of 12, even 18 months to get into these evaluations for children. And if your child's nonverbal at 3 years old, that is just very, very troubling for families. They don't know what to do, and it sounds like there's some of that here, and it could be, I hear burnout in that question, caregiver burnout. The daily needs of a parent to try to, with a child struggling, is tremendous, and I've heard this from countless parents over the years, and I'm hearing it in that I think I hear that in that question. We need to support the parents, not only getting the diagnosis, but I think Dr. Bozeman mentioned, getting the help in the home, in the school, in every domain of that child's life.
And what do you do? This is such a heartbreaking issue, and it's hard. It's hard
Yes.
on a daily basis. How do you advise parents when you see them as their physicians? How do they continue with the struggle? How do they take a respite break? What can they do for themselves so they can keep going?
Speaking specifically to advocacy, there are advocacy groups. For example, here in Houston, the ARC of Greater Houston. And so the ARC also has locations in other parts of the country. And they help with advocating also, like in the schools and so forth, with getting individual education plans and so forth. On the individual level, working with the parent, we would encourage them to also seek assistance. And so coming to a place like Menninger, we would see with the parents and we would work with the parents, one directly, like parent training with dealing with the child with autism, but also with their own mental health and with their own making sure they're taking care of themselves. So, you know, the irony is oftentimes as parents, we care so much for our children that we want to sacrifice and put forth so much effort with that. But you can end up having the counter effect, because if you burn out, then you're not going to be as effective as being a parent. And so we can help and assist with that. So it's very important for parents to take care of themselves and to seek the resources that they can so that they can have the energy to address these issues with their children.
We talked a few minutes ago about it's difficult to get a babysitter for a young child who may have serious autistic characteristics, because tell me what happens when the child acts out and the babysitter doesn't know how to handle it. What have you seen with some of your patients?
We use the term special needs for a lot of things these days with children. And I think when I really think of some of the children with autism, this is really the definition. These children could have multidimensional, I mean, across their functioning. So speech, communication, behavioral, sleep. And then so just having a babysitter come in for respite, that could work. But I've had parents that have gone through numerous babysitters. So much so that the babysitters start posting, you know, don't babysit for this, because they could post on you now, just like you could post ratings on them, and that this is tough. So just to expect that person who's in college or home from college, home from college to take care of an autistic child that they have no relationship with, they don't know how to communicate, is real. You generally need specialized care. Even family members could burn out. And I have families that won't get invited to certain big holidays anymore because the child is so disruptive, and that the situation is somewhat out of control. So helping the parents, helping us with the behavioral issues that we see here at Menninger is a way of helping. Helping connect the families to local resources is a way of helping, and sometimes even treating the parents directly in those cases where it's necessary. It's really all of the above. It's not any one thing.
So can parents self-refer if they are stuck in the bottleneck, as we discussed, and they can't get a developmental expert to look at their child? Can they come here? Can they just call Menninger and say,
Absolutely.
I'm going to bring my child?
But we're blessed with the Texas Medical Center and lots of other good local facilities here. I don't know if everyone here is from Houston, but there are major places, mental health deserts, where it's very hard to get these evaluations in many areas of the country. There's a couple fantastic centers of excellence, generally around the major cities, especially around the coast, but there's a lot of areas where it is difficult. And that's where I think there are government initiatives to get kids diagnosed by 36 months of age, but the studies show many get diagnosed at 4 years of age, 5, even later. And that oftentimes is too late to see the full benefits of the therapies that Dr. Bozeman, you and I are talking about today.
One of the other family members of an autistic teenager wrote, her name is Lizzie, and her question is, does having depression along with high-functioning autism make diagnosis more difficult? And once you have the diagnosis, what can you do to help a teen with high-functioning autism?
So part of that differential diagnosis, or distinguishing that, is part of a thorough history. So a mental health provider or a medical provider should take a thorough history. And from that, we can separate things like co-occurring disorders such as depression from autism. But one of the points that her question hits on is the high frequency of co-occurring mental health disorders with people with autism. So as much as 2/3 of individuals with autism also have another diagnosis. And as much as 70% at some point have had a depressive episode. And so that is an important feature, and it's another reason why seeking mental health services can be very important for not just addressing the social issues and communication issues related to autism, but also the co-occurring disorders such as depression and anxiety.
There are a lot of conditions, I couldn't agree more, that we just can't stop with a diagnosis of autism and just focus there, because there are conditions like ADHD, epilepsy and seizure disorders occur in 20 to 25%. GI disturbances, constipation, things like this that are very treatable. We talk about autism and the interventions, but there are no cures, but there are other conditions that are quite treatable. like ADHD, anxiety, which goes underdiagnosed, I see very frequently in the office, just never even thought of, because the child's in their own world, how can they be anxious? But just because they can't verbalize that emotional state doesn't mean they are not anxious. And then things like depression, bipolar disorder, and other conditions can occur, just like they do with those of us without autism.
Mm-hmm. And that's where some of the medicines come in that you can use that can help with the symptoms?
Medicines, psychotherapies, sometimes they have to be tailored, and with clinicians that know how to work with people who have autism spectrum disorders or other developmental disorders, who could work with people with medical conditions or speech and language conditions. It's not necessarily something that is garden variety for some clinicians, and you have to be specialized. We have, like Dr. Bozeman, many fantastic clinicians that feel comfortable with this population.
And can you describe applied behavior therapy? That seems to be the gold
Speaking of-
standard for autism. Can you kind of talk us through what that would be for a child with autism?
So it differs by setting and by what the goals are. So for example, you can have applied behavior analysis for problematic behaviors, and you can also have it for general skills training. And so by that, it would differ by setting. One setting might look more like a classroom, another setting might be a more natural setting, which would be like in the home. So what applied behavior analysis is it's an intervention in which we first try to find out why the behaviors are occurring or why the lack of a behavior. So some behaviors you want to increase. So if it's school type of behavior, you want to increase that. If it's what we would consider a maladaptive behavior, such as self-interest behavior, like biting your hands, you'd want to decrease that. And so what we look to do is to find out what the function of the behavior is and why is the behavior occurring. And then we look to reinforce more pro-social behaviors that we want to increase. And we try to keep from inadvertently reinforcing behaviors we want to decrease. And that's a really important aspect. So sometimes parents will tell me, well, I have this book and the book says do this. Well, a book is going to be a one-size-fits-all because the book doesn't know your child. And so, for example, you might try to provide a consequence for an unwanted behavior, and that consequence might provide extra attention for the child. Attention might be the very reason why the child is engaging in the behavior. And now what you've done is you've accidentally reinforced that behavior, and the behavior will increase. And so doing a good assessment is a crucial part to an intervention. And so on its most strict level, we have applied behavior analysis, which will be conducted by BCBA, which is a certification that's national. Different states have different licenses, and they might call it something else. And then you have behavioral trained psychologists that might also do such interventions. And then you have it in kind of looser forms also, which will be just behavioral-based interventions that might be provided by psychotherapists or so forth, or by people in the school setting that will do similar, but we might also have a mix of like traditional talk therapy.
And these therapies are done almost every day. They're done very rigorously to help make a difference?
Yes, and there's part of the catch. So ideally, they should be done every day. Ideally, it'd be 40 hours a week, and that's what the research shows, where you get really
Like a
strong
full-time job,
results.
it's really tremendous.
But unfortunately, that would also take a lot of funding. And so what we see is we have a lot of families that maybe might be more affluent and that can afford such interventions, but unfortunately, most families cannot afford that many hours of intervention, but that is the ideal. And so, as far as that would go back to advocacy and talking with state legislatures and so forth and trying to increase funding. I've had families that have had luck with talking with their insurance companies and getting their insurance to cover more of these services, which in the end does the insurance company well because it avoids later costs down the road.
And we have a couple of wonderful questions here. This one is from Anna. Do children outgrow some of the symptoms of autism?
With these kind of therapies, like Dr. Bozeman was going through, some symptoms can improve over time, so they will not meet the criteria to be technically diagnosed on the spectrum, and that's a fantastic outcome.
Mm-hmm.
We didn't really consider this. It was like, once you have autism, you kind of always do. This was what we thought, many of us in the field. But yes, you can outgrow that with these treatments and early interventions. This is the why you would do this. It doesn't mean that it's cured. Many of the people that outgrow these strict criteria for autism still have deficits, still have troubles in day-to-day life, but they could get to the point where they could have jobs. They could be, like I said, have some in college. They could have relationships, meaningful relationships, and that's what we want for all our children. So I think that's the case of why to do this. But also just underline, it's not easy. You have to advocate, like that first question, and it's expensive. I have a colleague whose his son was diagnosed with autism about a year ago. In addition to having very good insurance, he told me he pays about $100,000 a year extra to get his speech, language, occupational services, the ABA, the intensive. That's not covered by insurance. So it is very expensive, and not all states really provide the necessary interventions to get those fantastic outcomes.
Another of our questions from our Facebook viewers is, do public schools offer help for children with autism? How much do they help?
So the services that the public schools offer could help tremendously. The question becomes, what services will they offer? And that can, again, differ by state, and that's an unfortunate truth.
And school district.
Right, and by district, but it's the reality. So the schools are, by law, by federal law, must provide assistance with autism. The diagnostic criteria in schools is a little bit different. So when you're talking about a clinical setting such as the Menninger or Texas Children's, they are going by the DSM-5, which is a clinical diagnosis of autism. And the schools are going by eligibility. Is this child eligible for receiving services under the autism category? And so in that case, you might have some high-functioning individuals with autism who will not meet criteria for needing that assistance in the school setting. Also, you might have somebody that's already getting other accommodations for something like ADHD or what they would call emotional disturbance that are so similar to the accommodations of autism that they won't give that additional designation. But the answer is yes, the school interventions are very important. And again, that would be a time in which you want to speak up and advocate for yourself and ask for an individual education plan, which they're mandated to provide by law.
The IEP. Yeah.
And so we talked about the medicines. There are a few of the medicines that may help for other symptoms of autism, but those medicines have side effects. There's nothing that's just a slam dunk, it sounds like, to helping a child who has irritability or who throws tantrums. What are some of the side effects of the medicines that you can use?
Well, just take a step back. There are two medicines that are currently approved by the Food and Drug Administration for irritability in individuals with autism spectrum disorder. So not for the core symptoms of autism, those symptoms we talked about before. We've gone over some of the social, the communication, the behavioral. And there's only two. One of them is called Risperdal, the other is called Abilify. Now, many others can be used, but those are the only two, and that hasn't really changed in recent years. They can have side effects, some weight gain, tiredness, fatigue, sometimes drooling, sometimes muscle spasms. So in general, I think if done correctly with a provider who's well versed in using these medicines, the benefits in aggression, irritability, hyperactivity, impulsiveness, stimming behaviors, fighting behavior, it far outweighs the risks. The risks need to be considered, and parents need to be educated. There's such a strong desire when I'm sitting with families here at Menninger to have something that will be the magic bullet, so to speak, the cure-all. And we just want to make sure that just because these medicines are approved by the government, they're not going to cure autism. They might not even address the core symptoms of eye contact, repetitive behaviors, rigidity, communication deficits, but they can improve some of the other symptoms that make quality of life better. Similarly, treating ADHD, anxiety, depression. There are medicines out there that are approved, but a lot of times they have not been fully tested in autism, and the side effects can be more obvious or more bothersome for this population. We don't always know why.
Oh, really? So the side effects in an autistic child might not be the same as in a child without autism?
Absolutely. Several studies have shown this for ADHD medicines. The Ritalin and Adderall that many people are on for over 2 million people in our country are treated with these stimulant medicines and do very well. Generally, very minimal side effects. As people with autism, you'll see a higher rate of side effects. That's in my experience, and studies have shown that. Sometimes the 10th or 15th side effect down that you get from the pharmacy down that you have to be aware of. And earlier in my career, this was really challenging, and many of us in the field struggle that the effects aren't as robust, they aren't as great, and the side effects are a little higher. But in general, if done correctly, it could still be a net benefit. It's just a different risk-benefit equation, Christy. You really have to think about it and be educated.
I know some people have asked questions online about CBD oil, the cannabis oil. It's being used now for a couple of types of epilepsy, genetic epilepsy. Now, people are interested in it for their autism, for the children with autism. What are your thoughts on that?
A couple of things. So one is that here at Menninger we use validated, so research-based interventions. And so right now, there's not the research to support CBD oil with the use of individuals with autism. Another thing to be careful about is when something's not FDA regulated is what is you're actually getting. So there's some studies out there that show the majority of CBD oil products actually do have THC. So now you have the active ingredient, the psychoactive ingredient of marijuana that's still evident in the CBD oil. And so it's something to be aware of.
What would that do with an autistic child or teenager?
There's no studies, and that's why I have families that say I saw on a website this, you could find easily the other side. I mean, the reality is the condition for some people is so severe, moderate to severe autism, that families are willing to consider anything. And even over my career, I've seen so many things come and go, almost in a fad-like way, whether it's intravenous secretin, immunoglobulin, casein-free diets, gluten-free diets, omega-3 fatty acids, magnets of all types, and so many other proposed things that are going to cure or fix autism. And I think you want to be very careful about anything that seems like it is the magic anything. Because the reality is, as what we know right now in 2019, it's a chronic condition. It could exist in mild forms, but it can also exist in very severe disabling forms. In general, it's a serious diagnosis. It's not, most families are not happy with Dr. Bozeman and I making this diagnosis to get that. It can be devastating to some families. It sounds like you've talked to some families that have 2 or 3 children or young adults with autism. Very difficult to manage. But on that said, you don't want to necessarily reach out for anything that's you hear about, because I don't think it exists right now. Some people will say it does, but I don't think that's the reality.
But in the pipeline, you have seen research now with young babies with the eye gaze and trying to diagnose earlier. Tell us about what some of the studies are showing in the research with young infants now.
So, historically we've talked about autism is starting to show symptoms around age 2, the toddler age, when the child should become verbal. But what we found out was also early on was that parents who had children before they had a child with autism were seeing it earlier, and partly it was because they now had a comparison point, and they were able to see some of the lacking social behaviors early on. And so what the research is showing us now is that you can start seeing signs of it very early on. So young babies will lack eye gaze, appropriate eye contact at a very early age, or they might not babble, because babbling is a way of trying to communicate and imitate language, and so that's pre-language, and so you won't see it as often with children that later develop autism. You might not see social laughter, so young infants, when you look at them and try to make them laugh, and should laugh back in return. And so we're now seeing that children that later develop autism may have lacked some of these behaviors when they're babies. They might also be more difficult to soothe, so children naturally want to feel comfort from their children and like being held, and so children with autism may push away or not like being held at a very early age.
How does it deal with that? If a baby's pushing away, do you try to cuddle them again, or do you give them the space? What's the right thing to do?
I don't know if there's a right or wrong in that case. It could be that eventually you know your child. Usually parents will tell me that they developed a way of interacting with that child. A lot of times they'll say, oh, in hindsight, now I know what it was. At the time, I thought I actually had an easy child because it didn't demand to be held all the time.
And there are a lot of things that are developing in terms of diagnosis that are currently available. There are changes on the MRI with children. MRI is basically uses magnets to get a good picture of the brain, where the overall size of the brain is actually increased in autism. Levels of neurotransmitters like serotonin are elevated in the blood. We don't know why, but there are more biological reasons to explain this. I think the genetic findings is very, very interesting. When we do the genetic tests, and this is looking for Fragile X, something called karyotyping, and a microarray, a quarter to a third will have genetic abnormalities or mutations. We don't know necessarily what this means. These genes encode proteins, so what proteins are not forming correctly or absent. I think we will see in the years to come more work in this to get better diagnosis, and in the earlier interventions that we're talking about now, and maybe more sophisticated biological interventions.
That may be, in a way, reassuring to parents. I have one friend who has an autistic son who's in his late 30s now, and when he was born, they were still blaming the mothers. You weren't holding your babies enough. And now you're seeing these genetic variations, which are a huge factor in these other blood chemicals that are higher in some children. And there may be some biological options in the future.
I think, the estimates are 3/4 of those with an autism spectrum disorder, it's from genetic reasons. And I don't know if that makes parents feel better or worse, but it is not mothering necessarily at all. And that was a very old and discredited hypothesis, along with other hypotheses, whether mercury preservatives in vaccines or MMR vaccines, that have also been discredited by a mountain of science. There may be immune functions to autism that are different, that still hasn't been ruled out, but these old debunked theories, I think, need to be put to rest.
We have a question from Sarah. Are there programs available for families that cannot afford the cost of caring for a child with autism?
We're talking about those.
So I can speak locally. Unfortunately, I can't give a national answer. So here locally, we have the Harris Center, which used to be MHMRA, and it's now the Harris Center. And so they're on a sliding scale, and it's income-based, and so a lot of the families there receive services for free, and others might pay a small portion based on their income. And then in Texas, they're called authorities or local authorities, and every county has a local authority. Here in Harris County, we happen to be fortunate because ours is more well-funded and better staffed than some of the smaller ones, but every county does have a local authority. And if they don't provide the services directly, they could at least help link you to services within the county that could provide the services.
Still, as you said, are these bottlenecks, but to get in the queue, to do the best you can to push forward, to get the diagnosis and the start. And are some of these therapies things that parents can learn and do at home with their children?
Absolutely. I think that having a parental piece is crucial. It's empowering to the families and recognizes that the majority of the teaching is oftentimes in the home environment with the family. Even if you're doing 40 hours a week, there's many other hours a week that are not covered. So families are very involved. They're really the greatest ally for me as a physician in the office to understand that child, what's going through. What are the signals of a child's doing well or is about to be going through a stretch where they're not doing well, or issues that a child might be able to verbalize, or even an adult, young adult, having the families part of that treatment is incredibly helpful. So the more teaching and education and things like today is really to educate people about what's out there. A lot of these technologies are already out there, but just are not employed consistently or not in a unified fashion. And hopefully people will take advantage of that and get better treatment, better diagnosis, and better outcomes.
And we're going to leave some of the information and the recommendations on the Facebook page so people can come back later or tell friends or family members if they want to check later. Just refer so that there will be some of this good information on the Menninger Clinic Facebook page. We talked about young adults and what happens when the child ages out of the school system and maybe some of the programs. Where does a young adult with autism head?
It's challenging.
Yeah, it's very challenging. It's a really good question. So a lot of people seem to see neurodevelopmental disorders such as autism or ADHD as childhood disorders. But you are going to eventually become an adult and you're still going to have the condition. But unfortunately, the services do decrease drastically when you get out of the school system. The school could be considered the #1 provider of services for children with autism. There are some services, such as I mentioned, the Harris Center or other mental health authorities by county. And specifically speaking to the Harris system, for example, they have a social independent living program to help adults gain employment, to learn independent living skills, to live on their own, social skills. But unfortunately, those programs are not frequent throughout the country. And so I would encourage families to contact groups within their areas, such as finding an ARC or maybe looking on Autism Speaks and trying to find services in their area. But unfortunately, that's an area where hopefully advocacy and so forth can help increase the services for these individuals.
I think it's one of the greatest areas of need right now. I think we're right now still trying to understand the last 10 years specifically. Okay, this condition is more common. We need to do a better job diagnosing it, recognizing it earlier. I think where we're going to be in the next 10 years is what to do with these mostly boys, young boys that were diagnosed and are now aging out of school. What do we do with them now as young men? How do we support them? How do we enable them to achieve their maximum potential? I don't think we as a society, whether here in Harris County or really anywhere has begun to fully grapple with that task. What are we going to do with our people, with adults, young men predominantly, in terms of work, education, social supports, social meaning. I don't really think there's many great programs out there that are fully addressing that in a large-scale fashion.
And on a positive note, there is some research that has shown that states that have spent more money on employment services are actually having higher rates of individuals with autism employed. And so that's great to see that correlation, because it means that people have identified methods that work and that are effective, and when they're put in place can help people gain employment, which in the end could save the state's money because it's less people that need public assistance.
Were they talking about some jobs were actually done well by people with autism because they were careful, they were jobs in industry where people were very carefully putting things together? I don't know if there's more information on that.
Yeah, there's some very interesting local programs that, teaching people to computer program with video games, that attention to the screen, to learn computer programming, I think is a phenomenal skill. Again, but I think in large scale, there's a couple of these kind of tests and pilots that I think need to be encouraged and incentivized. But on a large scale, I don't think we have all those answers yet. A lot of parents have to know someone who will hire their son or daughter for this job or help support, and it seems much more local grassroots right now.
And so the technology here is a gift, but I know earlier we talked technology can also be a crutch. And how does a parent know when a child who has autism is on the computer too much?
So we recommend treating it as the same as any other child. So the recommendations on limitations on screen time and technology that's set by the American Pediatrics Association, we recommend, so 2 hours during the week of screen time.
During the week or the day or a day?
Well, preferably during the week,
Yeah.
it'd be very limited. Yeah, so weekends maybe a little bit more. But overall, you still want to limit that. So now, if it's like facilitated communication device, that might be a little bit different as opposed to gaming or things that keep them entertained. As we mentioned before, it can be very difficult, it can be stressful for families when you have somebody that's in constant need of supervision, and therefore sometimes it might be a little bit easier to have that individual entertained with something like a notebook, an electronic notepad, but we caution against it.
Because you want the child to interact, you want the child to speak, and we
It's
talk.
not high quality social interaction. Playing a video game, even if it's with another person that's thousands or miles away, that's not really the kind of social interaction we're looking for. So social skills groups, social building, partner groups, that much more helpful and generally preferred and recommended.
Yes, and we also oftentimes see maladaptive behaviors when those devices are taken away. And so a lot of times what we call the antecedent, the event that happens right before like an aggressive behavior, will be that the electronic device was removed.
So what?
I shut the Wi-Fi off and he hit me.
Yeah, well, and what do you do at that point? I mean, what does a parent do? They can't leave it on, forever, so.
And
what are
that's where the
options?
behavioral interventions and the parent training and so forth becomes so important, because that's where we're gonna put a plan in place. And so whether that's a BCBA on a very structured, kind of formal, or if it's just working with your mental health psychotherapist that comes up with kind of a more general, broad-based contingency plan or behavior plan within the home.
If they like time, would you do something like it's 9 o'clock, at 9 o'clock we always turn off your iPad? At 9 o'clock, was that one of the options, or what would you tell parents?
Yes, that would be a similar type example.
I see. And we talked before about language. The earlier you can teach the children to use their words, the easier it will be later to help control the behaviors, because they can speak. Is that one?
Absolutely. The two biggest prognostic factors when families say, well, how do I know my child's going to do well or not, are language skills and IQ, basically ability to acquire knowledge. So those are the two prognostic factors that are there. So developing the language, IQ, a little bit more fixed. I mean, that's sometimes many children on the spectrum have below 70 IQ, which is intellectual disability, or borderline IQ, which is below 85. While that can't be helped, working with language skills can. And these are two factors that you really look at. And you talk about a little one before elementary school or elementary school, how well they can do as they grow up.
And are there any other things that you would want to to tell parents, to give them some hope. Because we did talk about, there's the occasional child who seems to outgrow some of the symptoms are difficult, or some children can actually improve. And the technology and the research is continuing. There's so many
Yes.
children in this situation that there's going to be a huge focus to help these children and the families.
I think we need to figure, again, like we talked about, like some other illnesses, autism went from being a catastrophic rare illness to something that is much more common than we ever thought, but there are interventions that can make a difference. So I think in my lifetime, something like HIV/AIDS, which was considered really, again, catastrophic, but now is a chronic manageable illness. Not curable, but manageable. Autism now, we do have World Autism Day. People get behind it, wearing their bracelets, going out to walk and raise money. I think that's important to destigmatize this, to take it out of the shadows, so that people with high functioning autism are not feared, people don't make stereotypes about them, and they're considered, that the sky's the limit, but they will have certain special needs and accommodations. There are people out there that are advocating, probably Temple Grandin, the TED Talk, I think, is one of the most well-known, with millions of hits, so there are many positive role models out there. But families need that hope, and I'm so glad you brought that up, because without hope, families can get very discouraged in the day-to-day functioning, to not give up, and to continue to look as the technologies advance for both diagnosis and treatment, to stay abreast of that, to make it personalized for your child, whether they're 2 or 3 years old, or they're 33 years old, because it really knows how we get the best outcomes.
I agree with what Dr. Stevens mentioned. It's having hope and knowing that your child still has strong potential, or your adult child. And so I have seen gains with people who have started their interventions late and they still made great improvements. They tend to be higher functioning individuals, but they still made great improvements in their ability to live independent lives, or gain employment, or complete college. And so that's the thing, is you push for their maximum potential. And so, like I mentioned, it's a balancing act. It's a balancing act between knowing what's realistic and getting the accommodations needed, and pushing to full potential.
Because you don't want to push too hard, because then they get discouraged. But if you don't push, you don't see the progress.
And there's the balance.
That's the
Isn't that
balance. That's the balance. Well, and we want to thank you both today. This has been very informative. We hope it's been very helpful for our audience out there. Whether you have a child with autism, or you have a friend or a family member who knows some children, we hope that you will refer them to this Facebook Live, because it will be online and you will be able to see some of the resources that they're going to put on here, so that you can make these calls, contact ARC, contact some of these other organizations, because our goal here is to make a difference and help make these families' lives a little bit easier. So thank you again to Dr. Jonathan Stevens, Menninger Clinic Chief of Child and Adolescent Psychiatry.
Thank you, Christy.
And Dr. Alton Bozeman, Menninger Staff Psychologist, who does the autism assessments. Thank you both.
Thank you.
Thank you for joining us, and we hope you'll join us again in February for our special Valentine's version of the Menninger Clinic Live. Back to you.